I'm Dr. Alok Ranjan, a senior neurosurgeon from Apollo Hospital, Hyderabad. I shall tell you about brain tumor. Brain tumor, broadly speaking, is either benign or malignant. Benign brain tumor have a very good result if it can be removed completely. But however, sometimes their location makes it very difficult to remove, and in those cases, we'll end up doing something called stereotactic radiosurgery. Malignant tumor have different grades of malignancy, low grade malignancy and high grade malignancy. The higher the grade of malignancy, the shorter the survival period. However, treatment such as surgery, if possible radical surgery, radiation therapy and chemotherapy can easily double the survival rate. Scan and neural monitoring, special instruments which can help us in removing the brain tumor as completely as possible. Of course, in difficult location where there are very important neurological function, we may be limited by the liberty we can take about removal. Intraoperative MRI scan helps us deciding about this. Navigation helps us in deciding about this, and we are well equipped with this. Now, malignant brain tumors are, as I said, again, radical surgery is the first priority depending on the location, and again, these instruments help us in doing this. Then we have role of radiation. There are two types of radiation, conventional radiation and what is called radiosurgery. We have the facility for both. And then comes chemotherapy. Fortunately, in most of the brain tumor, chemotherapy is not very expensive and is based on one drug. Now, it is important to recognize them early, and how we recognize them: if the patient has an unusual headache for a long time, or has a weakness of one side of the body, or it presents with seizures such as convulsions at a later age, then we think the patient might be having a brain tumor. They may also present with loss of vision, loss of speech, which may be very subtle to start with. It's very important that they see a specialist where an MRI scan is done and we can identify and get some idea about what the tumor is. Early treatment makes a difference, because if the tumor is small, obviously surgery, radiation both have better role to play. So we must think about it whenever we have unusual symptoms of headache, convulsions, weakness, vision loss, especially gradually, and we must reach an expert so that we can investigate and rule it out. Thank you.